for watching SHEM Ministries, Souls Honoring Elohim's Mandate. And now for today's message.
Well, hello. I guess you felt that Dr. Anna Shaw Devlin with SHEM 2, a part of SHEM Ministries, forgot you. But no, never, ever. Thank you so much for tuning in tonight, Tuesday night, August the 3rd, the 4th, at almost 10 p.m. Please forgive me for the lateness of the hour. However, I need you to know that Dr. D was learning new things about medications and treatments so that I can present those things to you. I do attend medical, I guess you could call it, there are conferences, dinner meetings, this, that, and the other. And more than likely, they're not on a Tuesday night, but tonight it so happened to have been on the night that I normally broadcast. But those of you who are still up, thank you so much for your time, your patience, and your attendance. I actually am going to present something to you. And if you see the header, it says Girl Talk. Let's rewind and replay. I'm going to present something to you that is good information that we can never get too much of. So, welcome. SHEM Ministries, Souls Honoring Elohim's Mandate, and this is our Spiritual, Healthy, Enlightening Mandate Ministry. Dr. Anna Shaw Devlin, please listen and enjoy tonight's message. To God be the glory. Hello, Greensboro and surrounding areas. That can be as far north as New Jersey and New York, and as far south as Florida, as far west as California. I'm reaching because I know what my God is going to do. Now, one day, remember these messages are recorded, and you'll say, I remember back in 2022, Evangelist Devlin made a statement that SHEM Ministries would be nationwide. Oh yeah. That there would be viewers all over the United States. And I am speaking it into existence through the power of the Holy Spirit. Because when you have two willing vessels willing to give their all in all for God. And I'm not, setting me up. I'm not setting my husband up. I'm just telling you about us. We love God. And I pray that we will always continue to pray for each other and keep each other strengthened. Now, as soon as you make a statement or make a declaration, the enemy says, I'm going to see if I can make you take it back. Well, guess what? I may not have been out here as long as some others, but I know I've been out here long enough to know that there comes a time when you have to declare things. You have to let people know where you stand. For God I live, for God I die. There comes a time that you just have to speak up and say so. He said, if you're ashamed of me, I'll be ashamed of you before my Father, right? I don't know why I started out like that, but I believe that was for somebody tonight. It's okay to say, that was the old me you talking about. I am new. I've been reborn. God has restored me or recreated me or allowed me to walk in the calling that he has for my life. I was hiding behind what you used to see. That is for somebody. Well, this is our SHEM 2 night. And SHEM is Souls Honoring Elohim's Mandate. And so I do welcome you. SHEM 2 is a spiritual, healthy, enlightening mandate ministry. And tonight, I am Dr. Anna Devlin. And I chose not to wear my white coat because we are representing tonight hope. Wait a minute. Let me pull my shirt up. Hope, fight. And cure. Sorry, y'all. I can't adjust the camera. Cure, fight, and hope. Okay? What does that represent? We're talking about girl talk tonight. What's the girls? Y'all know what girls are. I mean, men, you may not know, but we women, we refer to our breast as the girls. Yeah, that's women talk. The girls. I mean, you guys have the boys. I hope. Well, these are the girls. And we're going to talk about the girls tonight. And because, what month is this? I gave you a clue on last week. This is breast cancer. Oops, sorry about that. This is our breast cancer awareness night. And we are going to go through some things. I know we've talked about them before, right? Throughout the year. And I do apologize. I'm looking at how I didn't have my camera just right when we first came on, but hopefully everything is okay right now. But we've talked about it, and I let you know we talked about different cancers, and breast cancer was one that we talked about. But tonight, we're not going to focus 100% on cancer. We're going to talk about the breast health. and which encompasses more than the breast cancer. But you know, I want to talk about, because so many women, and well, let me say this. Breasts are a big deal. They are. It's if we could, and I didn't do the statistics on how much money women spend on breasts, not just the, I mean, like the bras, just brassieres that they wear. Just so many different things. We're even going to address augmentation and implants. We're going to, you know, and even with the augmentation, there are breast reductions where there's too much breast tissue and the breast tissue is removed. So, but let's first, I've got a bunch of things here, and in order for me to cover them all, I'm going to talk fast, and I'm going to do my best to get everything that I really wanted to talk about. All right. So first of all, let me start out by telling you that where I gathered my information from, and I love going to multiple resources. I don't try to, you know, the same thing over and over again. So tonight, I'm going to present information to you from the Mayo Clinic. MAYO, Mayo Clinic. And I'm going to tell you a little bit about the Mayo Clinic. You know, and I told you I don't utilize information from places that are not reputable and this, that, and the other. So mayoclinic.org, you can pull that up. It is a nonprofit organization. It's committed to clinical, proactive education and research, right? Proactive is when you seek, search, find in advance. You don't wait for something to tear up. You proactively look for it, fix it, right? So you educate, and that's one of the main things that I love is to proactively educate. And they also do research. They provide expert whole person care. Now, what does that mean? Whole person care. That means from the crown of your head to the soles of your feet. And you know how I feel about that. That encompasses your physical health, your mental, emotional health, all of the health, the social determinants of health. Everything is addressed when you do whole person care. And to everyone who needs healing. Now, that was a quote from the mission statement, the website. Wow. It said, everyone who needs healing. Now, what are we? Are we not a spiritual, healthy, enlightening mandate ministry? And is our focus not on healing people and proactively preventing sickness and disease? Yes. So the reason for choosing this website, because I wanted you to hear the information. So if something is promoting education and believing in taking care of everyone who needs a healing, I wanted you to understand where what I'm about to say has come from. Okay. Now, and this Mayo Clinic has campuses, major campuses in Rochester, Minnesota, Scottsdale and Phoenix, Arizona, and Jacksonville, Florida. I mean, it's out there. All right. Enough said about that. Now, let's see what they have to say about breast health. Breast health begins with breast awareness. If you don't know about, and let me put my little, let's put this up here. Okay, breast health. And actually, let me just put both of them up here. It's just going to make me a little bit smaller, but it's okay. As long as you can hear me, that's all that matters. All right, because these are the things that we're going to focus on. And I apologize on my girl talk on the other side. It was supposed to say keep. So keep, know them well. K, E, early evaluation. E, early treatment. And P, protection. So keep. You want to keep your breasts, right? Yeah. So to keep them, you got to know them well. Early evaluation, early treatment, and protection is that's a lot. That's a loaded, it's loaded, because protection involves educating others. Protection also comes with knowing your family history. Protection comes with there's a list of things that we're going to go through that decrease your risk of breast cancer. And there's some things, recommendations. Some of them are strong recommendations and some are just trial suggestions that they're in the process of studying that support breast health and also reduce our risk, supposedly decrease our risk of breast cancer. Okay, so protection is loaded. And then I've got an acronym, TLC. Everybody knows TLC, tender love and care, right? So in our girl talk, tender love and care, T stands for talk about them, right? What do women love to do? Or we're accused of doing? Gossiping, right? So why do we gossip about everything else going on in the world, but we don't gossip about breast health until we think we got breast cancer? And then we start asking questions and saying, I got this something's wrong with my breast. Why do we do that? Why can't we gossip and talk about our breasts, the girls? Why can we not talk about the girls, right? Like we gossip about other girls, right? Why can't we not talk about the girls when we don't know there's something wrong with them? Okay. And then the L, I've got keep them in line. Keep them in line? Yeah, alignment. Listen, we don't spend enough time just taking care of our breasts. We want it when we're young and our breasts may stand at attention. We don't pay no attention to not wearing a bra. We think it's cute, it's sexy to walk around with no bra on. And I mean, I see people out at the grocery store and clearly they don't have on a bra. I'm like, woo, okay. And then you wonder why, as you age, your breasts droop. Gravity been pulling on them breasts for years. Okay, I'm just saying, listen, some of this stuff we know now that we didn't know then. Okay, I'm just addressing it. But keeping them in line, actually, I mean, I'm talking about supporting them. Adequate support. So that when you support something, for example, we women support each other, right? We're going through, we're struggling, we're having this. Do we not support each other? We come over, we clean up for each other, we do this for each other. Don't we support each other? We stand behind and give our support. Well, why we don't support our girls? Those girls, the breast girls. I believe if we supported them better, like compression support keeps them from getting all crazy. Okay? We'll talk about that a little bit more, but keeping them in line. And then the C is check them out. Tender love and care. If you really love something, are you not going to check it out? Are you not going to make sure that they're okay? You love your car. We talked about that on last week about how keep our engine running and how we love our car, and we keep it washed and waxed and new tires and those beautiful rims and this, that, and the other. And we get the oil changed, and we get the radiator flushed or whatever. We do all of that stuff, right? We put the STP in the gas tank and all of that. Well, we need to check the girls out. We need to keep them checked out. We need to do the clinical self-breast exams, and we need to get our mammograms as well. So those are just the header and a few things that we're going to address. So now as I go through this stuff, you got a reference and you know where we're going with them. Okay. So breast health begins with breast awareness, getting a sense of what's typical for you. That's why we said know them well. You got to know what's normal, what your body normally looks like, feels like, all of that. And do you remember when we were talking about breast cancer a while back? And I said, the earlier the better you teach young girls, right? We're talking girls talk, right? As the breasts start to bud and start to grow, pre-puberty, puberty, that is the ideal time that we should start teaching girls to get comfortable with touching and feeling their breasts. It should not be a surprise to them to when they are 20 years old or even younger, if they have a little lump or something, and they'll say, well, how long has it been there? And they say, I don't know. But if they're young from puberty and they know that their breasts always felt that way, they'll say, oh, I've noticed that ever since I was 12 years old. Okay. So teaching the girls, or our girls, whether it's your daughter, your granddaughter, your niece, we need to teach the girls how to examine and know their breasts well. Okay. So being familiar with how your breasts usually feel makes it easier to detect when there's a change. Over time, you'll discover how your breasts change in sensitivity and texture at different times depending on your menstrual cycle, age, and other factors. Wow. Yes, you are not going to have the same breast tissue you had when you were a teenager. Okay? You're not. And when you go through, because you got to remember about hormones and what hormones do. They will mess you up. And then we're going to go through some other stuff like about our diet and how our diet affects our breast tissue. Okay. Concerns about breast lumps, breast pain, or nipple discharge are common. When you have questions or concerns, talk to your healthcare provider. And it says, based on a clinical exam, your provider can talk with you about imaging tests you might need. And we're going to go through all of that. It is important to understand the screening tests you may need for early detection of breast cancer include clinical breast exams. They're done annually by your primary care physician, or if you go to a gynecologist, okay? Mammograms, breast ultrasounds, and breast MRI. And we are also going to talk about, which I did mention before, about 2D and 3D mammograms. Dense breast tissue may require additional screening exams. And I don't have the pictures of the different stages of density, but I'm going to address them and we'll go through them. If you have a strong family history of breast cancer or high-risk breast lesions, you may need additional testing with breast MRI. All right, and that's the part where I was mentioning about protection, and that's knowing your history and protecting the next generation or protecting, younger members of your family. If you're thinking about breast augmentation, now what is breast augmentation? That is like changing or the breasts that you were given, you're augmenting them, okay? You're adding to them, which would be making them bigger, like with implants. If you're thinking about breast augmentation or breast reduction surgery, understand the process. You got to understand it. And I've got some info we're going to go through. So I am going to try my best to just read so that I don't forget to address something. It's not that I don't know this stuff myself, but I like to read to you what the literature says, and not so that you'll know it's not what Anna says. Okay? That is the main purpose of me reading stuff to you all. Has nothing to do with what I know or don't know. Because a lot of what I know, sometimes I throw in experiences, which isn't an additive, nothing wrong with that. But I want you to have information that you can study and research for yourself. All right. So, learn about who's a good candidate for surgery. What to expect from the procedure and possible risk and complications. Talk to your provider about a referral to a plastic surgeon to learn about your options. So in order to even be considered for breast augmentation or breast reduction surgery, you have got to walk in the door knowing your breasts. You got to know your girls well. You got to. And I know that you have to have a recent mammogram, okay, before a surgeon would even consider doing anything to your girls or touching your girls, okay? That sounds kind of whatever, but it is what it is. All right, now, where do I want to go next? Let's do breast cancer prevention. And then I want to talk about density of the breast and why breast density matters. And so this is some good stuff right here that if I don't get to other things, these are the major things that we need to address, is talking about density of the breast. Because a lot of women don't realize the advantage and disadvantages of knowing your breast tissue. And I am going to explain some things, some key things, all right? So when we talk about breast cancer prevention, how to reduce your risk, it starts with, number one, healthy habits, such as limiting alcohol and staying physically active. Understand what you can do to reduce your breast cancer risk. All right. And then there are some things, there are 12, I think it's 12. There's 12 things that have been recommended to increase the, not reduce your risk, but increase the health of your breast. Okay, and we're going to do both of them. All right. So if you're concerned about developing breast cancer, you might be wondering if there are steps you can take to help prevent breast cancer. Some risk factors, such as family history, of course, you can't do anything about. Those cannot be changed. However, there are lifestyle changes that you can make to lower that risk. Research shows that lifestyle changes
can decrease the risk of breast cancer, even in women at high risk. To lower your risk, as we already mentioned, limit alcohol. And what it says is the more alcohol you drink, the greater your risk of developing breast cancer. The general recommendation is based on research on the effect of alcohol on breast cancer risk, is to limit yourself to no more than 1 drink a day, as even small amounts increase the risk. Now, remember what I said. I told you in the beginning, and that's the reason why I took the time and did that. I extensively went through where I got this information from. All right. Maintain a healthy weight. And let me say this one last thing about the Mayo. The website has a screening, it is called, it gives a code, and HON code, standard for trustworthy health information. So it's basically like a code of conduct. So it lets you know, it's got this seal of approval on it saying that this information comes from a trustworthy source. I just wanted you to know that. I forgot to tell you that you can find that when you see something stamped like that. You remember how we look for the Better Business Bureau and all of that to know, anyway, so that HON code is on there. All right. So let's continue. All right. Uh-oh. What'd I do? I done shifted my stuff. I am so sorry. Okay. Mixed it up. Sorry. There we go. So maintain a healthy weight. So if your weight is healthy, work to maintain that weight. If you need to lose weight, ask your doctor about healthy strategies to accomplish this. Reduce the number of calories you eat, blah, blah, blah. So let me say about weight. Breast tissue, a lot of your breast tissue is adipose tissue. It can be. Just fat. You lose weight, you lose your breast tissue. Or you may reduce the size of your breasts, and then the breasts themselves become more healthy. Okay. So I have talked to some women who were like, oh my God, these breasts are so big and they're so heavy, and I've got all this back pain and discomfort. And my recommendation, before you even consider having a breast reduction where they go in and remove some of the breasts, is to consider and try to lose some weight. And you have to have an excess of, so many grams of breast tissue before you even considered the surgery to have a reduction. Insurance is not going to pay for a reduction just because you want your breasts smaller. No. Nope. You have to have a certain size and a certain weight, the breasts themselves. Okay. And that is where we also talked about, we're going to tie in with breast density, because when your supportive tissue is the dense breast tissue, and the fatty tissue is your non-dense breast tissue. So when I was telling you that a lot of your breast tissue is composed of adipose tissue, that's what I meant. Okay. All right. So be physically active. Physical activity can help you maintain a healthy weight. It also helps you prevent breast cancer. It helps you prevent cancer, period. Any cancer. Okay. There is nothing that I've ever read that the suggestions of reducing your risk, come on now. Everything I just read to you, 3 of them are known to decrease your risk of any cancer. And that is alcohol consumption, healthy weight, and being physically active. Those are ding, ding, ding. We talked about 3, God's perfect number. Those are 3 things that you will always see listed on prevention of something. Yep. Yep. All right. So, physical activity can help you maintain a healthy weight, helps you prevent breast cancer. Most healthy adults should aim for at least 150 minutes a week of moderate aerobic activity or 75 minutes of vigorous aerobic activity weekly, plus strength training at least twice a week. Now, that's like lifting weights, okay? Huh? Bring it here, honey. Bring it here. I got a tweet bird. And my little outfit, I'm burning up. I'm getting hot. Okay, so I got a question here about breast transplant, in a sense, like fatty tissue. And no, you can't get breast from another woman that may need more fullness in their breasts unless that person, well, this is the deal. It's kind of like a blood transfusion. You have to type and screen and everything has to match. Tissue has to match in order for you to do that. Now, I will say this. Your doctor can take fat from other places in your body and put them in your breast because that's your tissue. So the risk of rejecting tissue, right? Now, if you got a twin sister, and I hate to take this off, y'all, but I'm getting a little on the hot side. Whew. So, but if you have a twin sister and you all have the same, everything matches up, that is a possibility, probably. But the odds are, if a woman has small breasts and she's got big butt, big thighs, big, she can take some fat from other parts of her body and put them in her breast. Okay. So thank you for that question. All right. Now, breastfed. Let's talk about breastfeeding because a lot of women don't realize this. Many women, they have a baby and their thing is, I ain't got time to be breastfeeding. I don't even, I'll just get the bottle and get some milk and feed the baby. But guess what? Breastfeeding might play a role in breast cancer prevention. The longer you breastfed, the greater the protective effect. So let's think about a woman that's never been pregnant. Now, we do know it increases the potential for breast cancer and for other cancers because of the fact that they never had those hormone changes that happen when you are pregnant. Okay? So, and it's minimal. I'm not saying that if a woman had... Because I know women that have breastfed and ended up with breast cancer. But we do know that women who are nulliparous, which means never been pregnant, never, have a higher risk of cancer. Breast and uterine, ovarian, whatever. Okay? So hormones are good to a certain extent. Limit postmenopausal hormone therapy. So, when you have the hot flashes, you may not want to take hormones. Estrogen, right? Combination hormone therapy may increase the risk of breast cancer. Talk with your doctor about the risk and benefits of hormone therapy. Now, and I also will say this, if you have a strong family history of breast cancer in your family, you also want to avoid hormone therapy. Hormone therapy is not always, it's not advisable. I strongly and believe that you should not, even if you don't have a history, unless you absolutely need it, because there are some other things that can be done to decrease the hot flashes and all that other stuff, and hormone changes like diet and sometimes vitamin supplements and things such as that. You always have to weigh out the risk versus the benefit. Always, in every decision that you make, you have to do that. Okay. Let's see. Right. This is just saying what I just said to you. You might be able to manage your symptoms with non-hormonal therapies and medications. Same thing. If you decide that the benefits of short-term hormone therapy outweigh the risks, same thing I just said, use the lowest dose that works for you, and continue to have your doctor monitor the length of time you're taking hormones. Can a healthy diet prevent breast cancer? Eating a healthy diet might decrease your risk of some types of cancer, as well as diabetes, heart disease, and stroke. So, blah, 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 blah. What did I tell you a minute ago? Maintaining a healthy weight, limiting alcohol, and being physically active are always going to be the top 3 things to help you reduce cancer. So, quite naturally, if you eat well, that's what it takes to maintain a healthy weight. So you done nipped it in the bud, right? And the diet of choice that is strongly, strongly recommended for health, period, is the Mediterranean diet. The Mediterranean diet is strongly recommended. What does that mean? Mediterranean diet is supplemented with extra virgin olive oil, mixed nuts. It also focuses on mostly plant-based foods, such as fruits and vegetables, whole grains, legumes, and nuts. People who follow the Mediterranean diet choose healthy fats. Remember, I told you got to have some fats because that's how hormones are made. Healthy fats, such as olive oil, over butter. And eat fish instead of red meat. I'm just saying. Mediterranean diet. Now, I will say that there are people who do well with the Mediterranean diet, even though they may eat butter and red meat. So that's a plus. Baby steps. All right. Is there a link between birth control pills and breast cancer? Now, I'm answering all these questions that, is really concerning. This is girl talk, right? We got to protect our girls. There's some evidence, and guess why? What are birth control pills? Are they not hormones? Okay. There's some evidence that hormonal contraception, which includes birth control pills and IUDs that release hormones. Now, all IUDs do not release hormones, but they can increase the risk of breast cancer, and that's the truth. Okay, I mean that's the truth. There's so many different birth control pills to choose from, and it's just something that you have to discuss with your doctor. And that's the reason why you got to start out knowing them well, talking about them. You got to know your breasts, and you got to talk about them to your providers, to other women whatever you have to do. Gossip about them. You got to. All right. So a recent study that showed an association between hormonal contraceptive use and breast cancer determined one additional breast cancer could be expected for every 7,690 women who use hormonal contraception for at least 1 year. Wow. Discuss your contraceptive options with your doctor and consider the benefits, the risk and the benefits. Okay, now that we talked about that, will eating soy increase my risk of breast cancer? Let's talk about it, because this is something that I came across that I was like, I don't remember too much about the soy. But studies show that a lifelong diet in soy foods reduces the risk of breast cancer in women. Because isn't it not plant-based? Yeah. This protective effect is less dramatic for women who eat less soy or who start eating soy later in life. Soy contains protein, isoflavones, and fiber, all of which provide health benefits. It was once thought that soy foods increase the risk of breast cancer. Now, I remember that. I do remember that more than I remember them talking about soy decreasing. Because what I remember was you need to avoid soy because it would increase the risk. However, it says eating a moderate amount of soy foods does not increase risk of breast cancer or other types of cancer. A moderate amount is 1 to 2 servings a day of whole soy foods such as tofu, soy milk, and edamame. Okay? So where did the idea come from that soy increases breast cancer risk? Isoflavones, which are found in soy, are plant estrogens. That's ding ding, estrogens increase the risk for breast cancer. So the soy okay, got it. So high levels of estrogen have been linked to an increased risk of breast cancer. However, food sources of soy don't contain high enough levels of isoflavones to increase the risk of breast cancer. Soy or isoflavone supplements, on the other hand, generally contain higher level of isoflavones. Some studies have suggested a link between soy or isoflavone supplements and an increased risk of breast cancer in women who have a family or personal history of breast cancer or thyroid problems. Basically, all of this information that I'm saying to you, I'm presenting it to you, but you've got to take that information and look at your overall history, family history, okay? Now, I'm not gonna I'm not going to go through each one of these, but I just want to name them. So these are the 12 things that have been identified to help reduce your risk. Reduce your risk or increase your health regarding your breast. And it says exercise, 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 right? We just went through that. Exercise, exercise. Working out can shrink the size of fat cells. We know that. Yes. So your body pumps out less estrogen. Remember, I told you fat was a hormone. Please remember that. Please remember it. Now, indulge in some chocolate. What? As if you need another excuse to eat chocolate, right? Researchers have discovered a compound in dark chocolate. I didn't say milk chocolate, I said dark chocolate. That may fight fast-growing cancers. The compound interacts with an enzyme which causes cancer cells to die but leaves normal cells alone. Now, this is according to Dr. Richard Pestle, director of the Chemo Cancer Center at Thompson Thomas Jefferson University. The finding may one day even lead to adding some chocolate to current cancer treatments. Now, this is research. Remember what I said. Research has to be done over a period of time in order to identify the degree of risk versus benefit. And then they'll give recommendations. It'll say strong recommendation, level C, level A, level C, level D, that kind of thing. Don't lose it over a lump. It is easy to freak out if you find something during a self-exam or to go into denial and do nothing. So let me also say this. Some women, many times a new bump may turn out to be a cyst or a fluid-filled sac, associated with hormone fluctuations. So, for example, there's a certain time of the month you don't do your self-breast exam when your menstrual cycle and you're hormonal. You wait until after your cycle is gone, when your hormones are back to normal. Then you examine your breast, because a lot of bumps and lumps and whatever, or fibrocystic breast tissue, especially if you do have fibrocystic breasts. So don't freak out. It may be there 1 week and you get an appointment, and by the time you go see your doctor, it's gone. But that's why I said, if you start to examine your breasts when you begin growing breasts, teach your young women, young girls, to start examining. If you don't remember or hear anything else I'm saying tonight, the earlier the better. Not just early evaluation, diagnosis, and treatment, but the earlier you are taught as a girl to know your breasts, the better it's going to be for you. Early. Know them well. That's one of the first steps in keeping your breasts. Knowing them well. Keep. Okay? Now, we already talked about fruits and vegetables, filling up on fruits and vegetables, drink less alcohol, get a good night's sleep. That's number 6. Staying up late can result in greater exposure to light at night, which suppresses melatonin levels. That can be a problem because research suggests melatonin may help regulate estrogen. Okay, right. But long story short, we know for you to be a healthy period, you got to get good sleep. All right. Some of this stuff is kind of, stretched out, but it all rolls back into the things that are necessary for you to be healthy, period. Don't forget folic acid. Not eating enough folate, the naturally occurring form of folic acid, is linked with impaired ability to repair DNA. You got to have folic acid in your diet, and most people don't have a difficulty with that. Now, I will say this, women who are trying to become pregnant, is recommended that you start taking folic acid within 5 years before the time that you plan to have a baby. Well, guess what? How many women plan it out like that? Maybe one? Okay. Now, it may be the second child, but usually the first child, okay, I'm just saying. This is be for real here. All right. And damaged DNA has in turn been linked to cancer. Okay. Folate is found in foods such as spinach and black-eyed peas, as well as in folate fortified cereals and grains. And it says here, try to get at least 400 micrograms daily. Okay. Practice peace. It could potentially be life-saving. Okay. Let me just say this about that. We all know that your mental health It has a lot to do with your physical health. All right. Take deep belly breaths where you feel it in your belly, right? It slows and elongates brain waves, bringing on calmness. And I believe that if, even I personally have had some difficulty trying to go to sleep. And when you take those deep breaths, I have done that, and it helped me get to where I could go to sleep. And I hardly ever have trouble going to sleep. It's just something that I learned to do. Make it dark, slow, deep breaths, and watch your favorite comedy. Enjoy, and that's the laughter. Laughter is healing, cathartic and healing. That's what, some of these things are just, they stretch them out, but we do know them to be truthful in just being overall healthy. Enjoying a good laugh activates the areas of the brain that govern humor, in turn suppressing the brain's stress regions, right? Being healthy, not stressed. Grab some dark grapes. The skin of grapes may have anti-cancer properties. Although the research isn't definitive yet, it's because of the antioxidants, okay? The antioxidant resveratrol, which is found in grapes, may protect your cells from damage that could lead to cancer. And yes, that's the same resveratrol that other studies have suggested may have heart health benefits as well. Okay, check this out. Didn't we just say Mediterranean diet, fruits and vegetables and nuts and olive oil, and just all falls back into the Mediterranean diet? And know your body, self-exams, maintain a healthy weight, get the screenings you need on time. All right, so this was just a quick list, which just reiterated some stuff that we've already talked about. Now let's talk about dense breasts, okay? Because this is one thing that you got to know that'll trip you up. All right. Dense breast tissue, what it means to have dense breasts. Dense breast tissue is detected on a mammogram. Additional images tests are sometimes recommended for women with dense breasts. You know why? So dense. Let's think about dense fog. When something is dense, it's difficult to see something hiding, that car up ahead of you, because the fog is so thick you couldn't see until you got right up on it. Well, ding, ding, ding. What would dense breast be? Same thing. So the more dense your breast tissue is, the more you definitely need a 3D mammogram. What's a 3D? That's looking at it from 3 different angles. Looking at the breast tissue, oblique, anterior, posterior, medial, lateral, and oblique. 3 good views of the breast tissue. All right. And let me say this. Back in the day, I really understand how and why there were so many women with breast cancer, or women who were not diagnosed early. But today, early detection is so out there for us. We have no excuse. We should not be detecting breast cancer at stage 4. Okay? I'm just saying that be proactive and aggressive. And I'm not saying it can't happen. Dense breast tissue refers to the appearance of breast tissue on a mammogram. It's a normal and common finding. Breast tissue is composed of milk glands, milk ducts, and supportive tissue. The supportive tissue, like I said, is dense breast. So if you think about something being dense, that is supporting the milk glands and the milk ducts, right? Because it's thick and dense. It supports them and holds them up like a good bra. And the fatty tissue is not dense. It's a non-dense breast tissue. When viewed on a mammogram, women with dense breasts have more dense tissue than fatty tissue. On a mammogram, non-dense breast tissue appears dark and transparent. Dense breast tissue appears as a solid white area on a mammogram, which makes it difficult to see through. Yep, like I said, like a foggy day, foggy morning. All right, so level of density are described using a results reporting system called Breast Imaging Reporting and Data System, BI. You may have seen this on your mammogram. BI, capital B, capital I, hyphen, capital RADS. It's BRI-RADS, and that is the breast imaging reporting. It's universal everywhere. So that you can get a mammogram 10 years ago and you get one now, you can compare the ratings and they're universal. So they shouldn't be too far off the criteria that was used to determine the score. The rating. All right. And A is almost entirely fatty. So if they say that your score is an A, that says your breast is almost entirely nothing but fat. And it indicates that the breasts are almost entirely composed of fat. About 1 in 10 women have this result. Scattered areas of fibroglandular density indicates that there are some scattered areas of density, not much, just a little scattered fog, okay? But the majority of the breast tissue is non-dense. There's about 4 in 10 women who have this result. Heterogeneously dense indicates that there are some areas of non-dense tissue, but that the majority of the breast tissue is dense, and that's 4 in 10 women. And then there is extremely dense, indicates that nearly all of the breast tissue is dense. Now this is rare. It's only about 1 in 10. So you're either, the end of the spectrum is you are almost entirely fatty or extremely dense, and there's only 1 in 10. So the majority of women are heterogeneously dense or either scattered areas of fibroglandular density. And out of all the mammograms I've looked at on my patients, those were the main two that I've hardly ever see extremely dense or entirely fatty. Okay. All right. So those are breast densities. And why does this matter? Having dense breasts affects you in 2 ways. Increase the chance that breast cancer may go undetected by a mammogram, since dense breast tissue can mask a potential cancer. Increase your risk of breast cancer, though doctors aren't certain why. So the reason why I definitely had to go through that with you, or wanted to go through that with you, if you know that your breasts are dense, mentally prepare yourself for false positive mammograms that may indicate that I might have breast cancer, so that you don't worry yourself to death. Know that my breasts are dense, and I know they're going to send me to get an ultrasound. It ain't uncommon. It wouldn't be uncommon. Would you not want one to make sure? If you know your breasts are dense and they say, I think that there's, speak up. These are the only girls you got, okay? Speak up and say, my breasts have been dense and they keep talking about this little area. Can we not further evaluate it? And I'm just telling you, if they don't, but the odds are they're going to suggest it, okay? The odds are they're going to suggest further evaluation. And there's nothing wrong with asking for a second opinion. Well, can I get another radiologist to look at it too? All they can do is say no. Let me tell you something. Don't be afraid. We cannot afford to be afraid to ask a question. One life to live. We watched the soap opera for years, but did you really listen to the title? You have one life to live. All you can do is tell me no. But if I don't ask, all right, well, I tell you what, there's some other things I did want to talk about. So we're gonna talk about the girls probably again next week, and I knew it was gonna be hard for me to get through all of this information, but it's necessity. This is our whole month of breast cancer awareness. Not that I'm not gonna spend the whole month talking about well, Lord, whatever you say, because there's some other things that we can talk about, talking about the girls. We can talk a little bit more about augmentation and reduction. We can talk about implants, the different types of implants. Yeah, I think we're gonna talk. So our time tonight, I think we made some pretty good progress on some stuff. And we got some stuff, some more stuff, because I got some pictures that I want to show you too. I do. And we're going to talk about the needle aspiration. Yeah. We're going to talk some more. The girls are going to talk. Okay? And this is one time, I'm telling you, gossiping is good. The more you gossip, the better. We have got to help our sisters out. We do. Like I told the men about talking about prostate cancer. You playing pool. Talk about prostate cancer. You watching the game. I mean, whatever. We gotta bring it up. We have these family get-togethers. And guess what? Next month is what? Thanksgiving. Thanksgiving and Christmas is the time that we talk. Girls should get together and talk. Talk about their history. And I'm not talking about, okay, so we're very quick to tell we had cancer. But no one wants to talk about, I've had drainage from my breast, or I've had inverted nipples, and I've had, implants that ruptured, and just talk about the girls. Talk about the girls, okay? All right. Well, God bless each and every one of you. I pray that the Lord will take this information and utilize it to glorify Him as you take better care of yourself. Okay? So keeping yourself healthy allows you to be that vessel that God can use even longer. And until next week, or until Sunday, hasta la vista, baby. All right. We love you and hope to see you soon. To God be the glory. This is Dr. Anna Shaw Devlin talking about the girls. All right. Take care. Have a good night.